good morning, everybody. My name is Professor Mark Britnell. I'd like to thank Dr. reimagining for inviting me to speak today. Some of you will know me. I've been coming to Saudi Arabia since 2012 and seen the country transform like no other country. A little bit about my background. I'm a former Director General of the English National Health Service, sat on the NHS Board, and then for 13 years was the Chairman and Senior Partner for Healthcare, Government and Infrastructure at KPMG. I retired from KPMG 3 years ago, and now I have 7 or 8 jobs around the world. But I do want to mention 2 in particular that enables me to keep coming back to Saudi Arabia. This is my 15th visit to the kingdom. I still consider myself a newbie, but I have seen how the country is transforming. The 2 specific roles I'd just like to mention before I start my presentation. I have the honor of being the senior advisor to Dr. Suleiman Habib Medical Group. I work with Faisal and Hasham, Dr. Suleiman and Emmeline, and it was great to see Faisal present yesterday over $2 billion worth of investment with HMG. The second job that I'd just like to mention briefly is that I'm a board member of Beamtree in Australia. And yesterday, Beamtree announced their formal partnership with Lean in Saudi Arabia. I have worked for your Ministry of Health. I have worked for the Health Holding Company, and I understand the nature of reforms that you're going through. But I want to talk about something that concerns me regarding your reforms, and certainly concerns me globally as well. But just before I do that, of course, those of us that have been visiting the kingdom for over the past decade or so have seen enormous changes. But I genuinely believe with your Vision 2030 and the Global Expo, the Global Exposition coming here in 2030, the whole world will realize the transformation power behind the Kingdom of Saudi Arabia. And the reason why I say that is just a little bit of history. The first ever Global Exposition, Global Expo, was held in London in 1851. And I feel this, if you look at the long arc of history, this is your time, the right place, the right time, because you have tremendous power, not only across the region in GCC, but also now increasingly across the world. And the reason why I want to just start with that self-axiomatic point, that self-evident point, is because if you look around the conference today, you will see the latest hardware, you will see the latest devices, and you will see the latest equipment. And that is fantastic. But what I want to talk to you about now in the next 20 minutes or so is the most unbelievable piece of software the world has ever created. And I'm going to reveal what that software is today. Are you ready? It's called the human being. And the reason why I say that is, looking at your reform program, which I have worked on, which I understanding from Reem about your ambitions for value-based care, it is quite obvious to me that you will not find all of the healthcare staff you need by 2030. So I'd like us to celebrate Vision 2030, like us to celebrate the Global Exposition in Riyadh in 2030, but just be slightly alarmed, perplexed, concerned about the global war for healthcare talent. Now, as you can see, I have the privilege of working in many countries over the last 15 or 16 years. And I have also had the privilege of writing 2 award-winning books that have sold in 109 countries, translated into Mandarin, into Korean, and to Portuguese. I hope I can translate it into Arabic as well. Although your English is better than my English and certainly better than my Arabic. But the reason why I wrote my second book is because wherever I went in the world, no matter how rich or how poor that country was. At the end of the engagement, meeting with ministers or leading health service executives or professors of medicine or professors of surgery, I always used to say at the end, how are you doing for staff? And they would always say, we're struggling. We can't find enough doctors or nurses or paramedics, or indeed great leaders that understand healthcare globally. And the more I started to look into this issue, and the more I got my research team to look at this issue, and by the way, if you're interested, when my book was published, there were 7,232 books or articles on health, workforce, and crisis. Many of them, sadly, in my opinion, were long on analysis, but short on solutions. And the reason this is a pressing matter is I know where you draw from now. You draw from Asia, you draw from Africa, you draw from India. Increasingly, you're drawing from Europe as well. These global movements of healthcare labour have been occurring for over 100 years. And the normal migratory pattern is from the poor south to the rich north and the poorer east to the richer west. Now, of course, because of your economic strength, which I've referred to already, you are changing some of those natural global winds, if you like. But the supply of healthcare labour is becoming fiercely competitive. And I want you to think about two specific issues. The first is, as you can see here, some very rich countries are struggling to find sufficient healthcare staff. My own country, 10%, there are 10% vacancies. But if you think about the most powerful, strongest nation on the planet still to this day, the United States of America, which spends 18.7% of its national wealth on healthcare, it is still short of 1 million nurses and 120,000 doctors. If I take you to Japan, where I love going, Japan are the oldest people on the planet with a life expectancy of 85 years of age. If you want to go and see the future, go to Japan. They've been watching this problem for 20 or 30 years. They have trebled the number of nurses, and yet they are still 250,000 nurses short. And then in India, of course, with Modi, we had the privilege of working with Modi on his universal healthcare reforms. He's doing that in spite of being short of nearly 4 million doctors and nurses. Now, so you can see, rich countries will always try and buy their way out of trouble. Because when you buy your way out of trouble, it stops you thinking about radical and innovative solutions. My first plea to you today is don't follow the West anymore. Most large academic healthcare organizations, for-profit or not-for-profit, are trying to unlearn the training and development of healthcare professionals in the 20th century. So you don't need to follow that. You are a strong, proud nation which the world is increasingly looking at. But the second reason I'm going to tell you, which is, I think, perhaps even more pertinent, if I was to ask you a question, what percentage of the world has universal healthcare, free or affordable at the point of delivery today, this year, what would you say? Would you say 100%? Would you say 80%? Would you say 60%? Would you say 50%? The answer is 40%. So imagine with the United Nations Sustainable Development Goals, which every country on the planet, except 2, have signed up to guaranteeing the delivery of universal healthcare by 2030. Think about what that means for the Indians. Think about what that means for the Filipinos. Think about what it means for the Mexicans. Think about what it means for the Indonesians. And then think about these global migratory patterns. Of course, rich countries can always buy themselves out of the solution, but that, I think, would be wrong in terms of actually making sure the world can face global pandemics and regional epidemics. But also, it actually, I think, as I'm going to show you now, will actually stop you reforming as quickly as you need. Now, in my book, which I hope you will read and buy, all my royalties go to prostate cancer. I survived prostate cancer at the age of 42. There are 10 solutions which, when they are worked on concurrently and consecutively, I believe we can reduce the total gap in the capacity to care. Let me just show you again this figure. By 2030, we can expect the world to be short of about 18 million healthcare workers. We have about 64 million healthcare workers on the planet at the moment. It's projected that we need about 82 to 85 million healthcare workers by 2030. That shortage of 18 million represents 20% of the total capacity to care. Now, I believe that we can close that gap by doing 10 things, and I'm quickly going to explain each one of them. The first one, and the previous speaker passionately made this point: health is wealth. On average in the world, the global healthcare economy, the industry, is now worth just over $10 billion. On average, an average country would spend 10% of its national wealth on healthcare. Now, when you think about the difference between rich and poor countries over 400 years of capitalism, moving from feudalism to global capitalism, there is only one constant feature that separates rich and poor countries. And do you know what that feature is? It's productive capacity. Now, if you want to spend your way out of trouble, you can always increase the pay of your healthcare workers. That's a good thing. But it will stop you being productive. On average, globally, the healthcare average global productivity per annum is 0.9%. Do you know what yours is? It's lower. And that's because your adoption of technology and a combination of 7 things in the blue box here, and you can have my slides. If you think about what goes into productivity, healthcare has all the elements: skills, training, life sciences, genetics, education, technology, infrastructure, supply chain, logistics, and so on and so forth. The problem is they've never been assembled properly. And as the American Nobel laureate Kruger said, productivity isn't everything, but in the long run, it is everything. It separates the poor from the rich countries. Therefore, your workforce strategies need to think about productivity, how humans and machines work together in more productive ways. The second thing that my book says is often many governments, I don't think this applies to your rulers, but many governments get confused about where they should be intervening. And there are 4 clear roles for government. First of all, do you have an equilibrium in supply and demand? For Saudi Arabia, the answer is no. Secondly, are you planning for productivity? The answer for Saudi Arabia at the moment is no. Thirdly, do you have proportionate regulation? Perhaps. Fourthly, do you have progressive immigration? And of course, you are a gateway now to many healthcare professionals that don't see their jobs just for 2 years now in the kingdom, but for perhaps longer. So the results, I think, for Saudi Arabia are mixed. We know traditionally that Saudi Arabia has been a very hospital-centered model of care. Build it and they will come. But research I did with Harvard over a 3-year period pointed to 5 models of care that are superior. I haven't got time to go through them all today. Clearly, the first one is the switch to digital. making sure you have a digital front door. Secondly, making sure that your health system is integrated. Your reforms are on the way to doing that. Thirdly, that you have much stronger primary care. And that, of course, is a challenge for all countries, and so it is as well for Saudi Arabia. But if you put these 5 models of care together, you get gains of between 16 and 20% productivity. So you're planning and building in productivity as you're transforming and changing. Fourthly, some countries now realize that patients can be partners in care. We know that there are 4 levels of care, or 4 domains for patients. The lowest level is where the patient sees the doctor as a god, and the highest level is where the patient sees the doctor as a guide. Counterintuitively, most human beings don't want to see doctors and nurses. They want to be healthy. And therefore, if you move patients from level 1, passive, thank you, I'm so grateful to, I'm taking control of my healthcare, you can look at this slide here, and this is from an insurer and a provider in South Africa, lower admissions, more life, less cost. Who wouldn't want that? And equally as well, but in older societies with an older population, you can see that actually getting members of the community now to be carers also is a way to actually improve life expectancy and to avoid hospital admission. In Germany, they are the oldest population in Europe, then the Italians, then the Brits. They ran out of healthcare workers. They have a very hierarchical, very traditional health service where the professor always knows best. And they said, what can we do? Their first response was to bring in cheap Eastern European labor. There was a political backlash, and then they had to think again. And what they did is they said to old, frail people, you can choose who's going to be your carer. It could be a member of your family, it could be a member of your community, it could be working with a healthcare professional, and in some instances, it was also even the postman or the postwoman. Hospital admissions for people over 65 reduced by over half, satisfaction jumped by 92 percentage points. Now, I think I know the audience today comprises of many clinicians who work in hospitals. I think this is probably the most important slide. Every 2 years, there is an educational survey, a pulse survey of how professionals think about their jobs and their lives. It's called PISA. Counterintuitively, 76% of doctors and 79% of nurses think they are overqualified for the work that they do. So, did I tell you at the beginning, what percentage is the total capacity of care gap? It's 21%. If you can help healthcare professionals take away the boring work, take away the repetitive work, and add value so they start to perform at the top of their clinical or medical license to practice, not at the 75th percentile or the 50th percentile, you will get massive increases in productivity. And we know how to do it. Redesign pathways of care, expand the scope of nurses, especially for nurses and allied health professionals, employ a new cadre of workers, and obviously put in a huge technology platform. I'd invite you to go to the HMG stand today and see what their cloud solutions are doing now in terms of actually looking at how technology can replace or augment labor. I've worked all around the world. Their solutions are genuinely, in my opinion, world leading. You have a world-class health tech company in cloud solutions in Saudi Arabia. Now, why is that important? If you can imagine that healthcare staff start to play at the top of their practice, not at the middle or the bottom, you can introduce different types of worker. They are less skilled, they are less qualified, but because of technology, they are able to serve patients. So when you're thinking about how you actually increase a nation's wealth, healthcare investment into skilled and unskilled labor with technology creates turbocharged value growth. And why is that the case? Because, as you can see here, it is estimated, when my book was published 4 years ago, the estimates were that 36% of all healthcare tasks could be automated or augmented. More recent studies now suggest that that percentage is 40%. So I'm relying on work from Accenture. They do know a bit about technology. And of course, you can see here in this very colorful graphic that on the horizontal is the type of work grouped into tasks. On the vertical, it is different industries. Now, of course, fortunately, healthcare will always be a caring profession where the kind heart and the warm hand of a professional helps a patient, a human being in need. But there are so many things, as you know, that once you start to demystify or clarify healthcare processes, and I'll show you a technique in a moment to do so, you can then start to get technology that works with the grain of healthcare professionals, that works with the grain of healthcare reform and transformation. Now, I have just spent 3 weeks in Canada with a couple of global conferences, and we had one in Vancouver 3 weeks ago, and we had about 30 different countries for clinical executives. So these are clinicians, usually doctors, sometimes other clinicians, who lead big health systems. What I'm seeing now is my book is already out of date. When I said to you 4 years ago, 36% of tasks could be augmented or automated, what we were seeing in Vancouver 3 weeks ago, the clinicians now saying already, they are applying artificial intelligence and already today getting between 20 and 25% extra productivity, especially in pathology, in radiology, and then in many ologies in an outpatient setting. Think dermatology, think rheumatology. So all of a sudden now, countries that are building a lot of fixed capacity will need to think about actually how they can close this 20% gap. I am more convinced than ever now. I don't know whether the world needs 85 million health workers or 90 million health workers or 75 million health workers. I do know one thing. The global workforce crisis in healthcare can be solved by human beings essentially implementing these 10 strategies. But of course, it requires a completely different thought process for employing healthcare workers. And this is where I think Saudi Arabia has still got some way to go. In many countries, HR, human resources, personnel, perhaps if you're lucky you get a chief people officer, they still are basically matching in an old-fashioned way jobs and people to job descriptions. Now, if you think about how crazy that is, if you join healthcare at, say, 16 or 18 or 21, I want you to think about how often has your job description changed in a job you've been doing. But you're getting older, there are lots of life events, there is marriage, there is partnership, there are births, there are deaths, it's buying a house, going abroad. But essentially what we need to do now, what the leadership cadre and the people officers need to do is move to agile workforce shaping. What does that mean? No longer match people to jobs, match skills to tasks. And once you match skills to tasks, that's the way automation, that's the way technology, that's the way that artificial intelligence works with the grain of humanity. It comes in peace. Now, there are other basic issues which I know the best organizations, healthcare organizations in Saudi Arabia follow. Now, this graph here behind me is very colourful and it's very small, but it's a piece of work that was done for the European Union. It looked at 28 member states, and it basically said to doctors and nurses, they were the only two constant data points, what's important to you at the beginning, at the middle, and the end of your career. And no surprise, guess what? Most of the 22 European Union countries said, at the beginning, when you're starting out, pay is the most important issue. You're thinking about perhaps marriage or a partnership or buying a house or having children. But then as you get into the middle of your career, having sufficient time to be the best healthcare professional you can be, to spend more time with patients. And as you get older, like me, you want more time to teach, to be your mentor, to share your experience. Now, of course, those three things, pay, job satisfaction, professional pride, and sapiential power, they run all the time. But our job descriptions don't reflect any of that. So the only way that you can think about recruiting and retaining people in the future is to be much closer to the organization needs to be much closer to the people. You can't see them as a unit of labor. You have to see them as a unit of joy. And that's because increasingly, and I see it now in Saudi Arabia, and certainly in the West now, different generations, we did a piece of work recently in Canada for one of the largest teaching hospitals. And the chief exec said to me, he said, I don't want you to look at the baby boomers and Generation X. He said, I want you to look at the millennials. And I said, oh, that's quite an interesting thought. And he said, well, our turnover rate with Gen Y and Gen Z is twice as high as the boomers and Gen X. And so basically, once you get stuck into a healthcare system, you tend to stay. But if you're coming in early, there is a lot of what we call churn or turnover, and that's about work-life balance. Pay, of course, needs to be competitive, but retention is key. And when I look at your turnover rates, as far as you have these statistics nationally, they are not good. They are not in the upper quartile, and that's where you want to be. And then finally, as I come into my last minute or so, we know there is a saying in healthcare, good people don't leave organizations. Good people leave bad bosses. 35% of the reason for any person leaving an organization, a ward or a department is down to the poor quality of management and leadership. And that's why I commend the work that REAM is doing. I commend the work that HMG are doing. I commend the work that the Health Holding Company is doing in really forging a new cadre of clinical leaders. You are amongst the best educated, well-educated people on the planet. You understand North America, you understand Europe, increasingly you understand Asia and Oceania. I genuinely do believe that you have so many opportunities to, I think, show the rest of the world what can be done. So, in summary, I've got 5 things to say. First one is buy the book. Secondly, realize that if you really want to transform the health sector in Saudi Arabia, you have to transform the way you look at human resources. Number 3, the global workforce crisis in healthcare is not a HR or personnel problem. It's a leadership challenge. Number 4, I believe that you have the opportunity, sure, follow the best of the West, but don't mimic the West. You have an opportunity with your global expo, with Saudi 2030, to apply technology and artificial intelligence in a way that very few other countries can do it in a standardized fashion. And fifthly, as I said to you at the beginning of this, and I'm coming now to the last 34 seconds, I believe when you look at the long arc of history, many countries have dominance for a period of time. The Romans, the Egyptians, the British, the Americans. This is your century. This is your time. This is your moment. Take it. Thank you very much indeed.